Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Well, hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. And yourself?
I'm living it up.
Yay.
I'm ready to go play golf.
All right,
what a gorgeous day in L.A.
Yes, but first, you're going
Wait, not
to...
first. First is what you don't know because you can't see me right this second.
Yes.
I am in my golf outfit. I've got my golf hat and my golf shirt.
You are good to go. That's hilarious. But second, we're going to see if you can help some people get out of musculoskeletal pain today. Here on Living Pain Free, we ask you to call the program at 1-866-870-5752. If you have joint pain, muscle pain, ligament pain, tendon pain, arthritis pain, neck pain, back pain, hip pain, knee pain, toe pain, any kind of musculoskeletal pain, I think you get the idea. When you phone the show today, you get Dr. Darrow's latest book for free. It is called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. And you can also go to the website. You can find Dr. Darrow at www.lastemcells.com. That's lastemcells.com. And if you'd like an ebook instead of the physical book, you can email Dr. Darrow off of every page on the site and ask your question and get your ebook. So that is what we have on the table right now. So again, we want your calls at 866-870-5752. We are here Saturdays at 10 a.m. and again at 1 p.m. But we want to hear from you right now. The hour goes very quickly, and every week we end up with people at the very end of the hour. We run out of time. We can't extend the show for your calls. We just have our hour. So please do call. The number again is 866-870-5752. What do you think, Dr. Darrow?
I'm ready to rock and roll, so let me start it off if you don't mind.
Go for it.
All right, so this is a question that just came in, and for those of you that don't really know me, I'm a little unique as a doctor because I do emails and I have texts and calls all day long, all night long. Every patient gets my cell number, and I love talking to you guys. So if you want to get to an email, all you do is go to my website, which is www.lastemcells.com. That's lastemcells.com. Every single page on the website, there's a lot of information, a lot of pages there, has a spot where you can email me. So this is one of those. This one starts off with the title Knees, which is really common, right? A lot of people have knee problems.
Oh, yeah.
So I love this one. This is so typical. It says, my orthopedist has told me I am bone on bone in both knees. Do I ever get to see that, Nita?
Oh, like 10 times a day, probably.
Never. I'm confusing you, and the reason is because it is confusing.
I'm letting you play with me.
I hear it all day long. I do hear it all day long. People come and say, my orthopedist told me I have bone on bone, I need a knee replacement or I need knee surgery, blah, blah, blah. And I check their knees out, I give them a quick exam, and I start laughing and I go, you got the best knees I've ever seen. Matter of fact, I had a man come in yesterday afternoon, same thing. I looked at his x-rays and there was plenty of cartilage in there. I don't know why the doctor was telling me he needed a knee replacement. I have no idea. But bone on bone to an orthopedist means I need to operate on you, okay? And that's a little crazy. Why would you have a surgery when you can regenerate the tissue by injecting the joint, tendons, ligaments, whatever it is, with a simple thin needled injection using cells from your body, bone marrow or PRP, or we now use umbilical cord stem cells. There is controversy about whether the umbilical cord stem cells are alive or not. I don't believe all this controversy. There are people in the industry that are trying to put people off track by scaring them because these guys only use bone marrow. I do it all. If you want bone marrow, I'm happy to drill into the pelvis and the back. It's a simple procedure. Once I numb up the area, it actually only takes me about 10 or 15 seconds to aspirate out the bone marrow. It's a fun procedure for me. It's a guy thing. I like drills. But unfortunately, or fortunately, most people don't like it. And although I've done thousands of them over the years, nobody wants to do it now that I'm using cord blood. That's from an umbilical cord, from a healthy mom and a healthy baby. These are not aborted babies. These are live babies. And the umbilical cord is donated to the hospital. So the person says the bone on bone in both knees. I don't believe that for a second. If they had that, they wouldn't be bending their knee or walking. I have very limited motion and bending radius on my left knee in particular. Okay, that doesn't mean that's bone on bone. A lot of people have plenty of cartilage and they still have contractures in their knees or other joints that block them from bending very much. That being the case, would your procedure still be a good option? Well, I can't tell you till I examine you. Thank you for your kind response. The thing is this, a lot of people have, there was a woman in yesterday I spent about an hour with who we got an MRI. It showed a meniscal tear in her knee, and she could not understand why that wasn't the cause of her pain. It didn't make sense to her. She's a lawyer, very analytical, and she had to go over and over and over and over and over this with me till I got her to understand that the pathology we see in an MRI may have zero to do with your pain. We know that because there's a lot of people we do as experimental subjects who have terrible things we find in their body, but they have no pain at all. And then we find people that have terrible pain, and then the MRI or the X-ray shows nothing. So don't get caught up in your imaging to decide whether or not you have a problem. You've got to have a doctor that examines you and moves you around and finds out where the pain is being generated from. That's called the pain generator. Why do we have failed surgeries? Need any idea?
Well, yeah, because the surgery wasn't needed in the first place.
That's right. And I had one of those on my right shoulder when I was in medical school doing orthopedic surgery, and my shoulder got much, much worse, and it blew up like a balloon. I had a fever, and I suffered with that misery for a couple of years until I discovered regenerative medicine. I injected my own shoulder. One time I woke up the next morning and I was pain-free. I was pain-free for a dozen years after that until I re-injured that shoulder. That time it took me 2 series of injections to heal it up. So be careful. Don't jump into a surgery. If it's an elective surgery, guess who gets to elect? You or the surgeon? Nita?
The patient or the client? Absolutely, not the surgeon.
No, it's elective. So if it's elective, that means it's not an emergency. If it's an emergency, there's a good chance you may need that surgery, but it's very rare that people come into my office that are in an emergency situation. Even if they've just gotten off the ski hill, their knee is swollen, it's not an emergency. We look inside with an ultrasound. If we see fluid, we aspirate it out and let them heal. So interesting thing, a lot of people come in with ACL ruptures, and so they think. Their doctor examines their knee or maybe gets an MRI, and the MRI shows an ACL rupture, and it isn't. Why? Because MRIs are overly sensitive. What does that mean? They show things that aren't there. So I'll aspirate under ultrasound guidance so I can get every drop out. And what do we see? Do we see red blood? Nope. What do we see, Nita? Do you know?
Well, you see some fluid. It's not blood, but it's
That's
just...
right. So what does that mean? Is it an ACL rupture? No. If it's an ACL rupture, it's going to be red. It's going to be blood. ACLs, when they rupture, bleed like crazy. So it's usually typically yellow synovial fluid that just show there's some irritation and nothing really to be worried about. So even if it is an ACL rupture, if it were, the studies show wait 90 days for the knee to heal before you do the surgery. But most people that have ACL ruptures don't need surgery. That knee is still stable. You have to do a test and see if that knee is loose. If it's loose, then you might need a surgery. So you guys can tell, you guys listening can tell, I don't like surgery. I've had it on me, it's failed. Why do insurance companies have the diagnosis failed surgery, failed back surgery, failed knee surgery? Guess why? There's too many failed surgeries. Be careful. When you have a surgery, most likely tissue is going to be taken out and you're going to destabilize that area and set it up for another surgery. If it's a knee, you're going to set it up for a knee replacement. I get too many people that come in after the horses are out of the barn, and there's nothing I can do. Once you have a knee replacement or shoulder replacement, hip replacement, there's not a lot I can do. You've got metal in there. The work I do is biological. We use cells, PRP, which is from your blood, or we use bone marrow or cord blood, and we regrow the tissue back and heal it that way. I've used cord blood on both my knees and both my shoulders with amazing success. So careful what you read on the internet. There's a lot of bunk, and I think I do, from what I'm told, the most stem cells of anybody on the planet. I don't know if that's accurate or not, but I've been doing this a long time. I've been doing regenerative medicine for over 20 years, and a good idea, go to my Yelp, YELP.com, look up Marc Darrow, MD. See what people say about the procedures. I don't pay them to say it. You'll see some bad ones there too. And then you'll see my responses to those people. What's up, Nita?
Well, excuse me, I'd like to just say that we're looking for your calls today at 866-870-5752. So you can call and talk to Dr. Darrow about your pain issues. That might be joint pain, knee pain, arthritis pain, back pain, neck pain, tendon pain. Any of the structures that support the limbs, the neck, and the back, that's what we're all about here.
And free copy of the book if you call in now or go to the website. So if you call in, what's the phone number, Nita?
It is 866-870-5752, and the website is www.lastemcells.com. That's lastemcells.com. There's a ton of research in the book and on the website. And on every page of that website, you can email Dr. Darrow. It's in the upper right-hand corner. And also, you can see him performing the treatments on video. So if this is brand new to you, call, ask your question. But if you need the visual, like I need the visual, then go to the website and look at the videos, because there's quite a few of them now. You're treating various parts of the body. So it's really all about regenerative medicine these days, isn't it?
It is, and there are 264 studies in the back of my book. People always say, where's the research? My orthopedic surgeon said there's no research. There's more research on stem cells, I think, right now than anything else in medicine. It's being used for just about everything. Heads up, I don't do just about everything. I only do orthopedics. I don't put stem cells into veins. I don't use it to try to heal different diseases. The FDA is not in favor of that, and I stay away from it. But there are people that do it all over the world. I'm not going to tell you not to do it, but I don't do that. We do have a 20-person research team at our office. Every patient who comes in is part of a research protocol, and we're getting amazing results. So far, we're finding that the cord blood stem cells and the bone marrow stem cells have equal efficacy. That means people heal up the same no matter which one they want. Now, occasionally we get people who still want the bone marrow even though they're going to have their pelvis drilled, but it's pretty rare. I get maybe 3 a week or so. That's about it. Everybody's opting for the cord blood, which is a lot simpler to do. But be careful. There's a lot of chiropractors out there who are hiring doctors who do not know what they are doing. As an example, they may inject a shoulder with one poke. You can't fix a shoulder with one poke. The shoulder is so mobile, and there are so many tendons attaching to it, and ligaments, and a couple of joints, that you've got to poke it about 20 or 30 or 40 times to get to all the areas where the problems may be. So your MRI may show that you have a labral tear in your shoulder, and you get a doc who injects it blindly. That means without ultrasound, he's not going to hit that labrum. It's impossible. But the labrum may not be the problem. So you've got to inject all the potential pain generators to heal that shoulder. So we got to be careful about that. Stay away from the chiropractors are great, by the way. I love chiropractors. There's one I work with named Randy Weinzoff in Santa Monica. He helps get rid of the sciaticas that come into my office. But I wouldn't use them to be doing stem cells because they don't know what's up. They're hiring a guy to come in who doesn't know what he's doing. They don't do it full time. So be careful what you're doing. Be very, very careful.
Okay, and our number is 866-870-5752. Should we go to Wendy? I mean Becky?
Well, Wendy and Becky, it sounds the same, but
Becky.
it's not.
Sorry.
Hey, Becky, Dr.
Hi.
Marc Darrow, how are you?
I'm doing good.
Good. Before we get to you, I'm just going to give out my office number for people who want to do an insurance verification. That means you can call up to 800-300-9300. I'll repeat it, 800-300-9300. You can call right now or anytime. And if we're not at the phones, we'll call you right back. And we can tell you whether we take your insurance. We do take Medicare, Blue Cross, Blue Shield, Aetna, Cigna, United Healthcare, and for those people without insurance, we can help you get a credit card for medical procedures called Care Credit. Hello?
Hello?
Yeah, you're with us. Okay.
Okay. Yeah, sorry. Doing too many things
No
at one
problem.
time. So here's a quick question. I know I already have osteoarthritis and rheumatoid arthritis.
Yep.
And so I have an ankle that the doctor said, oh, you're bone on bone.
Can you walk?
It's very hard. I live on
Can you
prednisone.
walk?
I can
Okay,
walk,
can
yes.
you walk? Okay.
Yes.
So I doubt that I doubt that it's bone on bone, but I can agree that it's arthritis if your doctor says it is, because that's easy to diagnose looking at an X-ray. And if you have rheumatoid arthritis, that is a sort of a destructive arthritis that can really eat up the cartilage. And you're on prednisone. What dose of prednisone are you on?
I take about 20 a day.
Okay, so that's a pretty healthy dose. And if you get off of it or you wean down, are you miserable?
Yep. I'm miserable with
Okay.
the 20. I just try and stay as small as I can,
Okay. Yeah.
Because I
Smart.
actually have it in both of my wrists,
Okay.
and now I'm starting to feel my other ankle. So
Okay. How old are you, Becky?
59.
Okay. So have you ever looked into an alkaline diet to quell or calm down the rheumatoid factor in your system?
Not really.
Okay,
I've heard
I would
of
look
it.
at that. Yeah.
Okay.
I would look at that. You can just go to Google and look up alkaline diet.
Sure.
You don't eat things like red meat because that's high in arachidonic acid. Acids assist in the process of the cells attacking each other, which is going on inside of you. And that diet may be a savior for you, okay?
All right. I'll do that.
Now, the question about whether my treatments can help you, I don't know until I examine you. If you have a red-hot swollen joint, it's not going to help you. But there are periods with people with rheumatoid arthritis, even when they're very inflamed, that inflammation can quiet down. It's cyclical. And during the periods where they're not having bad inflammation, we can use PRP from your blood and inject it, or use your stem cells and inject it. Okay, but it won't do any good if you're if one of your joints is all swollen and red hot.
And I tend to be. I've had it for almost 20 years, but I've just had a hard time finding anything. I'm like on my 8th drug that does anything.
Okay.
So.
Okay. Well, I'm so sorry to hear that. My heart goes out to you, and I would look again at. Have you seen an alternative MD?
Not yet.
Okay. Well, I'm going to give you the name of someone that I use who's in West LA, right across the street from me. His name is Alan Green. And
Okay.
I would check in with him or someone like him who works with these kind of disease states, can help quiet them down. Once we get you quieted down, we can use regenerative medicine to regrow some of that tissue that's been chewed up already, okay?
Okay.
But you're going to have some work ahead. You know, the work is going out and finding the right doc for you. No one likes to take the time to do that. And then doing a diet. No one likes to do a diet, but I find people with all kinds of inflammatory conditions that can palliate. That doesn't mean heal, but palliation means to quiet things down and make it tolerable. And if you can do that, you may save yourself from joint replacements in the future.
All right. Sounds like a plan.
Yeah, and it may be a diet that you have to stay on the rest of your life, but, you know, God bless it. It's something that can help you.
Well, it's worth it. So.
Yeah. And if you want to get a hold of me to talk more about rheumatoid arthritis or other things going on with your joints, you can just go to my website, which is www.lastemcells.com, lastemcells.com, and I will promise to email you right back. And if you want to get to the office to find out more, call 800-300-9300.
Okay.
Sound good?
Does. Sounds very good. Thank you.
There's hope for you, Becky. It's just going to take some work on your end.
All right. Well, I'm tired, but I'll try.
All right. God bless you, honey. Hang in there.
All right.
Thanks for your call, Becky.
And this Dr. Green?
What about him?
You said, how do I find him?
Oh, you can email me, or you can just Google Alan Green, MD in West LA.
Okay, I'll do that.
Thank you.
Thank you. Bye-bye.
Bye. Our number is 866-870-5752. That's 866-870-5752. And we're going to Edgar in Marina Del Rey.
Edgar, Marc Darrow, how are you today?
I'm good, doctor. Thank you. I just now tuned you in, and somebody had given me your name a couple of weeks ago for stem cell, and I wrote it down. Anyway, tuning in here, I thought I have this question about my left hip and the pain that I've had for 2 or 3 years, and then getting to the point where I could just hardly walk. And, anyway, it went. 95% of the pain went away, so that I can now walk. Well, that's one question. Like, why is the pain from the inflammation, which can be separated out from the arthritis?
Yes, it could be. You're absolutely right. Good point. And I don't think I've ever thought about that before.
I had it for so long. Oh, I'm sorry. I didn't mean to interrupt.
No, it's okay. I'm going to ask you a couple of Let me ask a couple questions, though. Yeah. Are you overweight?
Not about 20 pounds.
Well, 20 pounds is a lot, because biomechanically that's an awful lot of weight on that poor hip of yours. So if you were to become my patient, I'd put you on the ideal protein diet. You'd lose that in about a month or so. And that's something that you ought to consider. You can either cut out all your carbs and just eat protein, veggies, and water and fat. Yep, you can eat all the fat you want. You'll lose weight because it'll keep your insulin low, and then you eat your own fat. But you got to drop that weight. And you say it's only 20. Are you like a big, tall guy or something?
Well, I'm like 210. I'm 5'11" and a half.
Okay. Yeah, you got to drop that weight. So you're about my size, but I'm 100, and this morning I was 170, which is high for me. I'm usually, lower than 170. So you got to drop the weight. The diet we have at the office is called Ideal Protein. And if you want to call the office to find out about it, it's 800-300-9300. We've never failed with that diet. We have people lose tremendous amounts of weight with it. It's real quick. I did it as an experiment for 1 week before I chose a diet for the office, and I lost 7 pounds in 1 week, and I'm fairly thin.
And, thank you very much. Is it possible that the inflammation and the pain will eventually cycle back in, just out of nowhere, or I'm taking fish
all
oil?
things are possible. Hang with us, Edgar. We're going to the break. We want to talk to you right afterwards.
Hold on with us, Edgar. You're listening to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752. Stay with us, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.